Hey guys, welcome back to another episode of New World Podcast. This week, me and Aris talked about mental health, specifically going to the definition of mental health and looking at mental health through the lens of the COVID-19 pandemic. Additionally, we talked about Bell Let's Talk Day and other initiatives such as BetterHelp. We looked at the main topic of awareness of mental health, how to determine if someone you know is going through a mental health crisis and what you can do to help them, as well as what you can do yourself if you are going through a mental health challenge. And finally, we looked at the future solutions of mental health, including psychedelic research and the biological effects behind it. And yeah, as usual, if you guys like this episode, please comment, subscribe, leave us a message, and hope you guys enjoy. 2020 was a tumultuous year. The question we must all ask going forward is simple. What values, ethics, and behaviors from the old world are we going to preserve? And what new perspectives are we going to embrace as we build our future civilizations? This is the New World Podcast with Aris Kaki and Akil Samji.
All right, welcome back, guys, to the New World Podcast. My name is Aris.
And my name is Akil.
And today, as you probably already saw, we're going to be talking about mental health in particular. As it is May, it's sort of the peak of Mental Health Awareness Month every year.
Yeah.
And there's a lot of PR going around, and it's been going around for the past few years with regards to mental health. It's become ever so more popular from ever before. And I think it's a really good thing that people are shining light upon something that for so long has been avoided, or we believe that, which we knew that existed, but for some odd reason, our society generally ostracized it, the conversation and made it taboo.
Yeah, they just avoided talking about it. Right?
Yeah, and I think with some other societies that either our parents come from, some people's family comes from, it's sort of considered culturally taboo, and for other societies, especially olden day societies, was something of a cultural or religious significance as someone was going under depression.
Yeah,
and so I think, with regards to mental health perspective on the New World, many people might be asking, okay, why would you be covering a topic like mental health when in reality, this is something that we totally know about, right? Yeah. And I think the reason why we should be covering mental health is because of its importance right now as we speak, considering the fact that we're still living in what most of the countries that we live in still have the lockdown measures with regards to COVID. And I think the discussion hasn't been had this year for some odd reason. We have the regular mental health PR going on, but I don't think anyone's made the connection. I think it's more obvious that the connection is there, but I don't think anyone has come out of significant prominence in society and has called it out for what it is, which is the mental health crisis, particularly during COVID, is probably going to be very disastrous and often something very dark. And we probably won't see the ramifications of some of the decisions that we made with regards to some of the decisions governments made, and probably for another couple of years now.
Yes, exactly. Yeah.
And until I think people are allowed to socialize in en masse again, I don't think you're going to see people. And then you have to remember that people prior to COVID, even those people that are already depressed in different areas of their life, it just literally exasperated that trend line. And so I think you're having not just the regular people who are already not just regular people and victims of mental health, but you had new victims and people who generally held on to something that they went to, either when they had the social interaction, that kind of saved them from essentially damaging themselves.
Exactly.
And I think without the social interaction, it's been about a year's plus. Sure, we've had loosening here and there, but there's really nothing going outside without a mask or without any of some of these restrictions and turning entirely back to normal. I don't think until that entirely comes back, I still think people are still going to go through hard time, and just mental health problems are going to reach at their maximum soon.
And looking at the mask, it's sort of like a bad symbol for a lot of people going through mental health, because every time they have to leave home, they look at that mask, they realize, oh no, I have to social distance, I can't meet with people, I can't talk regular, life has changed, and it makes people feel more of that depression, or just go through those changes,
Yeah, I think it's acting sort of it's acting as sort of a weird mechanism of how much society's changed. Some would call it essentially what happened was some of our healthcare professionals essentially had to use some sort of societal public health measure, some of our public health systems with regards to not just the science, but the population health science stream of medicine, which is essentially not just the virology or the epidemiology, but rather the people with the statisticians and the other parts of the medical establishment that come together to sort of make this proposal based off data and modeling and how frequently this virus comes up in people. And the idea was that, okay, this is sort of the solution that we've pitched it to governments, and it's up to public policymakers who've been given the trust by the people to make the decision on their behalf. And I think you're right. With regards to the mask, I think a lot of people now treat it as something. Initially, people just treated it as what it was. I don't think people looked at it as being such a divisive, and not just divisive, but just like a symbol of isolation. I think now more than ever, it's sort of hard to just see through the mask.
That's exactly
like it's been sort of like a weird thing to not be able to find out who is like on the other side of that mask.
Exactly.
And I think it's leading to much more darker times because with before, like you could see people's smiles. Like it may seem like a really cliche thing to say, but like a smile could go a long way for a lot of people. And just not even the smell, but being able to just see like new things and just be the like quote unquote freer, like to go outside to experience the world. And I think with COVID and especially with the lockdowns at first, and then the loosening of the lockdowns, but the persistence of the mask policies, I think you've essentially created this restriction on freedom of people and to move around and to do whatever the hell they want to. So I think it's something that like people are still undergoing, and we don't know the full, like we said, we don't know the full ramifications of it.
Exactly.
I think you're seeing now, however, more young people bring it to the forefront, which you've spoken about the fact that mental health was already a thing. I think now people now, which to me seems a bit frustrating, at the same time silly, which is that it's odd to me that people didn't recognize this idea before. I think it's weird because this is an unprecedented like step in policy. So if you go back to like every health policy that we've ever had, with regards to like viruses or massive like en masse epidemiologic or pandemic level responses to anything, there's sort of been an effort to quarantine, which is some sort of like, it's an olden days idea. It's not really something new or revolutionary. Like we've always had quarantine different areas of the region of the world before it became a pandemic.
Exactly.
And I think this is something unprecedented because this is a population health measure that's really never been taken before. And I think because it's so new, it has opposition, but at the same time, it's something that we have to look at critically before using in the future. I think the good news is like with the vaccine rollout and a lot of the other things loosening, it's showing signs of regressing, like the virus in and of itself and the whole entire crisis, including the economic one, and the social and the cultural one. But we have to make sure that like the fact that we've used this, it's somehow, some way, it's created a precedence and it's in our arsenal now. And I think if you go out to anything like that we've ever used as humans, like when you look at nuclear war, or you look at something like splitting the atom, right? That thing is like kind of a Pandora's box in a way, because you really open it up and you really can't close it back. So I'm just wondering whether or not like something like this, with regards to like, I'm not questioning intentions here, but all I'm saying is that with regards to the lockdowns, it could be that the cure in of itself was worse than the problem, right?
I feel like this pandemic was really like a test to try out the solution of a lockdown, because as you said, it has never been tried before. But I think looking at it like 3-4 years down the line, they'll probably look at all the stats of, especially with mental health, how it affected the virus, the spread, the cure, the vaccines, everything, and see for future pandemics whether they want to apply it again or not. Right?
I think it questions the effectiveness of some of the policies, and I think you're right. Like generally speaking, whenever like government, but not just government, whenever we're in a crisis, generally speaking, we don't receive the feedback or the full extent of what we actually did until years later, when people begin to question. Now it could turn into sort of something a bit more drastic, in the sense that it's becoming more and more divisive, I think, like the measures of the lockdowns. And so I think it depends now what exactly governments around the world do at their discretion. Like we have different regions of the world opening up than others. We have like subnational areas like states and provinces and different jurisdictions who have the power to make their own decisions and their own reversal of these measures, take those, and then I guess now you're sort of seeing this weird petri dish experiment happening, which is like there's different regions of the world that are opening up, and there's some regions that are even cracking down harder. And I guess it goes back to the point where how the numbers actually work, right? Exactly. And there's many people now that the more and more stats are showing up about the fact that the drug use, drug abuse, domestic violence, sexual assault. I'm guessing there's much more underreported and not even reported crimes from done to these victims that they're not even coming forward, because of the fact that there was a lockdown. They have to go somewhere, and they're going to go back to the exact same house, so they don't want to make sure that like it's created a very weird time to be in environment, because often you are able to like go somewhere externally, but for some reason externally everything's closed. It's to sort of remain internal with everything that you have. And I just think with regards to just mental health and substance abuse, it's definitely shot up into the sky for sure. Yeah.
And I think talking about it is really like a really good first step.
Mhm.
Although it may not seem like it's doing much, I think raising awareness of it does do a lot in the long run, because the more people that are aware about it, the more you can see the signs and like you can kind of figure out if someone is battling mental health, and then you can figure out ways to kind of help them and combat it.
Mhm. Yeah, I'm wondering whether or not, like, with regards to the approach of things. So in a way, this is sort of some sort of like social engineering project, in the sense that like you sort of see how you socialize, you've conditioned, that for lack of a better term, but you've conditioned a population for about a year or so to stay away from each other, to not see family, and sometimes the conditioning can go a bit too far, in the sense that like these habits have been built. Like often there's, I don't know what the arbitrary amount of days is to build a habit. I think it's like 20 or something, or 3 weeks, I think, to build, like, to get a solid habit like into someone's schedule. I think so, but fact check me on that. But yeah, like if you think about it, regardless of that amount of days, it's been technically a year. So in my eyes, if someone's practicing something like social distancing and mask wearing, it's definitely become a habit of ours. Like it's somewhere in our subconscious that we have to put on a mask wherever we go.
Exactly.
And I think to a certain extent, it would be odd to me, like whenever this is all over, like how just society and like the populace would react to reopening. And then that reaction's third and fourth effect on mental health. Because people with mental health disorders are probably at this moment like either isolated or just finding ways themselves to deal with their pain. It's often the bad versions, which is we all know for the fact that that substance abuse goes extremely high amongst men in their middle ages, especially those that are going through mental health and depression. And mental health affects all people, but essentially there's sort of a disparity between substance abuse and often consumption amongst men versus women. This includes like everything from like hard liquor and binge drinking, and of course that leads to a whole different like plethora of problems. And I think we're looking at some young people, especially, and the odd thing is that with regards to the regular mental health disorders, you're right in the sense that it affects like like single people, single men, or older like middle-aged men who drink constantly, and like there's a sort of like you have this sort of character profile of someone who's going through like chronic depression. But then now we more so know that it's everyone goes through mental health varying degrees, but for some odd reason that I'm starting to see that the lockdown is sort of disproportionately affecting young people's mental health. For the first time, I'm not saying that it's fully young people, but for generally speaking, young people are, I would say, resilient. Young people generally seem in the normal world have always seemed to be very resilient. Like they always find issues to problems, or they have something going for them. Not to say that there's never any mental health issues. I think there's always something going for them as well. But for some odd reason, I guess it makes sense. You've restricted people to their homes. And I think for the first time in ever, I guess young people don't have somewhere to look towards, to go somewhere to like enjoy their day. And I think that the fact that they're restricted by geography, it's just something very unique. It's like you've essentially conditioned an entire young generation to be fearful, right? And yeah, I just don't know. I think this is a really interesting thing to study as a topic, especially in the next coming years, as to how much it can affect the mental health crisis, the response with regards to what other dominoes were set into place, what other dominoes fell with regards to mental health, suicide, all those numbers, which I think will be coming up very soon.
And I just wanted to pull up a couple of facts from the Center for Addiction and Mental Health here in Toronto. And of course, all these facts that we pull up, we will put the links in our description so you can take a look at it further. But two facts that I noticed was one, that young people aged 15 to 24 are more likely to experience mental health and or substance use disorders than any other age group. And we find that really important, which is why we made this episode, because our audience is Gen Z, which falls within that age. And so we really want to bring awareness to this topic. And especially with COVID-19, the last stats that I found were from 2016, which said that there are about 34,000 mental health cases. And I'm pretty sure, unfortunately, that's on the rise with the whole pandemic and the lockdown, right? And again, most of them are substance use disorders or schizophrenia disorders. And then honestly, we can really see the impacts of what it's happening, right?
And I think people we tend to forget about like the most extreme cases, which is like cases of self-harm, which is a pretty dark place to like touch upon. But I mean, it is reality, and we really don't know exactly what people will be going through. And I just think that it's something to consider, the fact that like what to the extent of which these effects have on the psychology of people. Like people. We know that global productivity fell by multiple units of deviation, whatever that may be, due to the fact that simply we're just all stuck in our homes, and then we're just sitting on our beds and on our couches, and so we're going on Zoom meetings or whatever. But there's a more likely chance that you're just sitting there, like passively absorbing information on the news or whatever. You're
just going from one screen to another.
Exactly, right? And there's a high chance that you basically weren't being proactive in any sort of means necessary, or I guess going above and beyond to solve some problems, but instead you were just sticking to whatever your requirements were to make it through the day. And I think with regards to the effect of global productivity, and then not to mention the fact that the one thing I think that's overlooked all the time is mental health's relationship to just binge eating as well.
Yeah, that's true.
I think people tend to forget the fact that like states of depression don't just have to be hard drugs. It can literally just be like people either overeating or not really giving any attention to their health. And I think with COVID especially, it's odd because the idea is that people stay at home and then they're basically just grocery shopping. Like we saw like how the grocery stores were all empty at the beginning of the pandemic and people just rushing for toilet paper and for other foods and all the shelves being empty, something out of like an apocalypse movie. Yeah. But it's like people are staying at home consuming this food nonstop. And because there's really nothing else to keep them proactively busy, which is really strange to say. But I mean, yeah, fitness awareness is rising during the pandemic, which is a good thing. Like people, more and more people now have dedicated the time to fitness, but at the same time, like there's a huge demographic that I would argue that I wasn't able to do it because they relied on external sources, i.e. a gym or a trainer, or to meet someone in public or to have someone encourage them to go to the gym. And I think with all that loss it's very difficult to, for many people, I know, to completely be sympathetic to them, to the fact that they can't make it somewhere and to improve their quality of life and their fitness. So yeah. And we can move on to sort of what are some of the initiatives that some of these current corporations or some of the current conventional established media companies are taking with regards to COVID, just addressing mental health per se, not necessarily just COVID, but we have the regular thing here in Canada, which is the Bell Let's Talk Day. Yeah, you want to talk more about that?
For sure, yeah. So I'm just going to pull up another stat. According to how much money they've raised, they say it's about $121 million committed to mental health initiatives from 2010 to 2021. And it's a great program because they do donate to a lot of different institutes and sort of like societies dealing with mental health. And you can check that out on their link. However, with pandemic times, it's really hard to see that to fruition because a lot of these initiatives that they're sending it to are things you'd have to go to in person. And with COVID closing it a lot, you'd have to look for other options. And so that's what we really want to talk about now is if you're dealing with mental health, just know always that you're not alone. There's always someone to talk to. And with COVID, there is ways to do it virtually. But if you don't feel like you have that privacy in your home, there's always ways to even do it through text now and even through phone calls. So you can even make it more private on your own. In your own room, you can just text like a person and try and talk about what you're going through.
Right.
And some of these initiatives include like BetterHelp, which I know I've been seeing a lot of advertisements of them on social media talking about these initiatives. And there's also places like CAMH, which I talked about here in Toronto. And there's an article from Huffington Post that shows a lot of resources and numbers you can call for people going through mental health. And we'll put that link in our description too.
Yeah, for sure. And I think with regards to Bell Let's Talk Day and these newer initiatives more like BetterHelp is that I think if we look at the sort of history of mental health awareness, how far do you think it would go back? Like how far do you think this first became a thing? Like this became such a mainstream, like everyone talks to the point where now it's become like a cliche.
Like I think it's really the 21st century.
Yeah. And like, do you think it was like the last 10 years, 5 years?
So, yeah, most likely like the 2010s, like especially when Let's Talk Day started.
I think if you look at like the past is that there's this awareness of like just people going through stuff. And people knew that people were just always depressed or this sort of, and then there was a sort of taboo and the stigma around like whether or not clinical depression is actually like diagnosed. Like clinically, you just have low levels of certain dopamine within your brain, for your happy hormones, essentially to keep you uplifted. So the sort of idea of like a clinically depressed person versus an actual just person who's just depressed at the moment, right? I think there's like the wording, the terminology, the stigma. I think that's always been there. And I think with more research, essentially within like with more things we know about psychology and psychiatry, and just things about the brain and neuroscience, I think we're getting more and more in tune with some of the wonders of the brain. And I think the more we understand the biggest, essentially the most important part of the human body, I think we also come up with the idea that how much of a complex architecture it has. And at the same time, it can also influence a person's mood regulation and everything. And so this is really astonishing to think about the fact that it's more of a recent phenomenon, the idea of mental health as being an actual thing, because like we've known for a long time, like diet, physical health, everything like cholesterol, everything's controlled. But I think a lot of people tend to forget that there's a brain gut like barrier, right? There's a blood barrier in between there as well. So you are what you eat, essentially, not just physically, but mentally as well. And I think now more than ever, it's moved on from food to like literally you are what you eat, but at the same time, like what you consume, your environment that you're in, the external infects your internal brain. I think that's sort of the conversation we're having now. And then more so now, we're also having the conversation, the fact that the food that you eat also influences your brain chemistry. And so that goes into the whole rabbit hole about dieting and just having food that in your diet and just essentially consuming things that make you more productive and make you more proactive and more inclined to get more work done versus actual food that sort of just satisfies you with empty calories and stuff, which is a whole different discussion for another time.
And I think going back to your question when you asked me, I think it really ties to the whole technological revolution of the 21st century. Because as you were saying, the more technology we got, the more we were able to analyze what's really going on. And the whole serotonin, dopamine, we're really able to more understand it than our ancestors were and people in previous generations.
Yeah, definitely. And I think, as you mentioned, the fact that it's more of like a more recent talking point. I think companies and startups like BetterHelp, I think they sort of pushed the envelope even further, because the idea was that with BetterHelp, essentially, I think the model is like genius in the sense that like it's connecting you with a licensed therapist. And I think for the longest time, there was a sort of the stigma of just going somewhere to talk. The whole talk it out, that stigma is kind of dying. But I think what happened is people just don't get, either the people they go talk to aren't really like trained professionals, or just a person, not the person, but just someone random who's untrained, or it's just, it doesn't go anywhere, or there's nothing really executable coming afterwards. And I think one of the things that we want to touch upon is, before I get to that point, is I think some of the biggest things prior to the conversation about mental health has always been one of the most controversial areas, which is pharma's role, big pharma's role, especially with regards to mental health. I think for the longest time prior to the conversation that me and you were having with regards to when Bell Let's Talk and like mental health and people go through shit, but when that became more mainstream, I think it's always been there, but it's sort of been like castigated by like, you like people you see in the movies, people just go to the bar and drink, or you have the so-called dark image of veterans returning from war and needing to pop pills just to stay healthy and not go through panic attacks, as if they're sort of having flashbacks to where they went to fight. And I think that image of veterans popping pills, I think that was sort of the perception of many people, which is that when people began to realize that like we can just basically pharmacologically just give you a compound of substances. We can sort of readjust your serotonin levels, or antidepressants essentially. But there's a whole variety of other cons that come with antidepressants. And I think for the longest time, people have sort of used that, and physicians and certain people within the medical industrial complex, as we like to call it, have sort of been complicit in the idea of like selling more and more of people's essentially health out to big pharma, which is $1 billion industry. And I think the fact that these companies and these doctors in the medical establishment, for the longest time, I think some parts still are inclined to just write you a prescription for anything. And forget just mental health. Like even if you're sick, there's higher chances the doctors would write prescriptions for you to go take like some antibiotic or just take a pill. It's like, wait, that's like not even that serious of a thing. You should be prescribing like, well, not as a doctor, but you should just basically, there's many of other things you could have prescribed with regards to lifestyle per se. Majority of the problems that we have health speaking and just mentally, as we all know, talking about it, everything else that goes on with it, BetterHelp, which is a licensed physician, it's more lifestyle individual choices. But for some reason, it's like pharma's incentives has always been to put something external and foreign into your body, simply to satisfy the status quo and to keep you average, whereas you're not really improving anything.
It's just a temporary.
And I think those perverse incentives of actually relying on these drugs and those pharmaceutical drugs have often led to the whole bad rabbit hole of then alcohol consumption and addiction, and then eventually like just death among some of these people who go through these mental health issues. And I think it's sort of like an entire primary, secondary, tertiary effects of what exactly happens when this decision is made, or these so-called special interests. And speaking of BetterHelp, I think as we mentioned, BetterHelp is sort of a company sort of that pairs you with a licensed physicians based off sort of an evaluation form that gives you someone personally to talk to. It's sort of not like a psychologist or like some sort of doctor that's going to prescribe you something. It's literally just a licensed therapist catered to you. And it's sort of like a subscription fee, I believe, to sort of consult with this therapist. And I just think this is the beauty about the whole just startup culture with regards to how many areas of life it sort of touches. And I think with regards to the mental health space, it's either generally been people relying on some sort of drug their entire life to satisfy or to just keep them barely happy or barely afloat. And then people who just basically tell them to deal with it and shut up. And I think that's sort of like a good dichotomy to address that sort of problem. And I think BetterHelp is someone, a leader in sort of the licensed therapy practice. And I think the times of like just conversing, I think that dialogue, maybe it's just a personal opinion of mine, but I just think that it doesn't really do anything proactively. Like talking about it with someone just to relieve it, I'm pretty sure it has done things for people. But I think if we actually wanted to go on the attack, I think instead of reacting, just waiting for someone to tell us and kind of absorbing it and sitting there, I think if people wanted to go on the attack, i.e. they can get the next stage is probably through companies like BetterHelp and to licensed therapists and physicians. And I think we're going to probably tease another one at the end, sort of like tease another solution at the end, which is sort of up and coming within the space of biopharmaceuticals and biotechnology. But before we get to that, you want to talk about the mental health awareness and sort of just something that can leave our listeners and viewers with sort of like a checklist to kind of check themselves and check others, especially in a time when people are just locked away from each other.
Yeah, for sure. So I just wanted to get into how you could recognize someone is going through mental health and how you can help them, because there are companies like BetterHelp, but that's more on the onus is on the person who's going through something to really register for it. And so if you're with someone who you think is going through mental health, you can take a look at the list we have in our description. I'm going to read a couple of points just to take a look. And if you see these sort of like signs, you can kind of talk to them and just let them know that you're here for them if they want to talk. But some of these signs to look for include like they don't have interest in hobbies and other interests they used to love before. They're angry or sad for little or no reason. They don't seem to enjoy anything anymore. Their sleep patterns have changed. They've been drinking heavily or using drugs to cope, which goes back to the whole substance abuse argument. And they're avoiding their close friends and family members. So if you see them, secluding themselves and like not wanting to talk with people, that's usually a major sign. And the ways you can help someone, in addition to letting them know you're here, provide emotional support. If they have appointments with doctors or with counselors, help them out with them, like take them there, go with them, give them the comfort that you're always beside them so they know they have someone to rely on. And also try to, if you can, support a healthy lifestyle, because it is a win-win situation. It helps you get a little bit active and it helps them take their mind off of the problems they're dealing with and become a little competitive with you. You could start doing, like jogging around the track and trying to see who can run the most laps or something, take their mind off of it. And obviously, this list is not exhaustive. Again, if the list is in our description, so you can take a look at it and see. It's a really long list of how many signs you can look for. But I think it's really important that we become aware of it and begin to talk about it so that more people aren't afraid and the stigma kind of goes away.
Yeah, and I think with regards from a personal perspective, there's often probably been people that we've encountered that have sort of gone through mental health problems. And generally speaking, the way like we've approached it, like from a very young age, or people that we've known for a while, like we're obviously still pretty young. We're like in our second year only of university, approaching our third year. And I think the amount of people that we sort of dealt with, like not just during COVID, I don't know if you've had any people to reach out to during COVID, but even prior, I think he's right in the sense that like creating, I think for most people during COVID, and we mentioned at the beginning that you mentioned that stat about people aged 15 to 24, particularly in the Gen Z demographic, right? I think most people nowadays aren't really, young people at least, they're resilient. It's just that I think at this point there's more to it than just the regular mental health crisis. It's more like I feel like it's turned into like an existentialist crisis, which is people are just like worried about the state of their futures. And I think, of course, that then contributes to additional stress, and then unwanted stress, and contributes to generally unhealthy eating. And then we go back down to the whole rabbit hole. And I think this is something new. I think people need to speak about this now with regards to the pandemic, and henceforth, I think, as we've mentioned in previous episodes, we've sort of spoken about multitude of things happening all at once with regards to the new world. But at the same time, I think people are just worried about how current trends are looking negatively for most people. And we always have suggested, if you haven't seen our previous videos on social media, our previous episodes on social media toxicity, and particularly mainstream media toxicity, you should go check those out. Those are our previous episodes. And in there, we're just basically speaking about the fact that your environment and what you watch, what you consume also matters, especially during the mental health crisis of COVID. I think what we tend to forget is that most of the things that happened, generally speaking, trapped in your home, are also influenced because people were trapped in their homes and then turned the TV on. And they were bombarded with things that are just negative imagery all the time. And then this made people dying, morbid like numbers and morbid headlines. And like I said, at this point, things are looking a bit brighter, like progressive, like globally on a global scale. Apart from India and just a few other, apart from India and a few other places around the world who are going through more dire times than usual, than all of us at least. So we're lucky to be doing a bit better. But like I said, it's more of an existential crisis at this point. And I think when people worry about their futures, there's a sense of urgency among young people to like get something done. But it's often that they just either feel like unproductive, lethargic, and just the setting the environment has been created for the sense of mediocrity, or like not being productive. That setting has been created, and I don't necessarily blame them. And at the same time, I think you're right in the sense that like mental health contributes to a lot of it, because if there's a sense of lethargy, then you're basically just consuming things instead of being proactive. And then it also depends on what you consume. And if you're just consuming negativity 24/7, you're generally going to be filling your brain up with like useless shit.
Yeah, exactly.
And I think it's just really important that people realize that if we all have personal stories that we've dealt with other people, we've gone through ourselves. And I think those stories are really good to be told to others, and especially just to like make it relatable to people. I think people need to understand that everyone has gone through some sort of mental health disorder, whether it be like something minor or just at a moment you kind of feel that like there are moments in your day and just in the year and in your life that you will naturally just feel depressed. And it's the whole idea of like life has its highs and lows, and you sort of will encounter that. But I just think getting through it and marching through it, it's definitely possible. And I think the idea of like just COVID being the sort of black swan that no one really called for, I think this too shall pass in a positive sense. I think this too shall pass, and once we get past that, I think it goes back to the regular conversations we have about mental health. But I think now more than ever, we have to also address the other issues of, like you said, eating, mental health, but at the same time, what you consume. I think all this is now becoming more and more conjoined together, which is what you're saying. I think the conversation is now switching from the original, let's talk about it, to what are some of the factors that influence mental health, i.e. what you eat, because we know this relationship between your gut and your brain, which we're discovering about more and more. In fact, just for anyone's interest, I sort of had this like second year university school project where we sort of explore the relationship between gut microbia and the development of Parkinson's disease in individuals. And the idea is like essentially what you eat literally can form a correlation and predispose you to have a higher chance of developing something like Parkinson's at an older age. And it literally depends on what you eat and where your food sources come from, and healthy food sources, and actually caring about what you eat. And it goes further than that in terms of actually just exercising. It's not a cliche just to look good. It's like you look good, you feel good. There's actual science, concrete science behind it. The fact that you're releasing endorphins, you're just high on these endorphins, and you're much more happier, and you're jumpy, and you're preppy, and you're ready to take on the day. And I think there's something to that. And so, yeah, just before we end off with our 3 takeaways, I mentioned earlier that we looked into some of these solutions with regards to how mental health has been treated. And what we looked at was, is there something new in the market? Like, is there something new that people are working on, thought leaders and leaders and just innovators are working on in the space of mental health? And I think something that it might come to people's minds, if I haven't said it already, is psychedelics and psychedelic research. And many people might be thinking, either if you don't know what that is, or some people might be thinking of psychedelics, might be just thinking of like people like loopy hippies in the 60s, but you're not wrong. But and for those of you that don't know what psychedelics are, so like psychedelics belong to sort of the mind-altering drug category of sort of this idea of like natural medicine or medicine derived from plants sort of have these mind-altering properties. And of course, there are synthetic versions of these and derivatives of these made in labs and pharmacology. But generally speaking, this idea of psychedelic medicine has sort of been in the forefront now after a long time. Psychedelics, for a bit of a background, it's sort of the research essentially said psychedelics was probably happening around post-World War II time. People just interested in the idea of like LSD. Some of these compounds include like your usual things that have sort of had a bad rep for themselves, like LSD, MDMA, dimethyltryptamine, DMT, and psilocybin, like these sort of main compounds. And each of these compounds is a unique like beast of its own. And it would take an expert and just more research on our part to go through each single drug and what are its applications and who are some of the leaders in this business. But I think psychedelics and the psychedelic space is becoming more and more accepted and less of a taboo, primarily because of the fact that more research is actually being done, not just from a government and academia perspective, but there's actually many more startups now partnering up with the university pipeline to kind of deliver solutions. And there's actually many startups that you can go search up right now on Google that are actually receive like Series A funding and VC funding and just government grants to research some of the effects that some of these psychedelic substances have on patients with alcohol like addiction. And there's more and more data showing now, the quantitative data, that psychedelics have a profound impact on veterans, primarily those who suffer from PTSD or people who suffer from PTSD in general. alcohol addiction, any other sort of mental health disorder, psychedelics are having a much more bigger impact.
Yeah.
And I think the sort of caveat to this is the fact that it's being microdosed under the supervision of someone professional who's been educated in the field of psychedelics. And I think for the longest time, people need to understand that psychedelics has been a taboo for the very reason that you sort of probably heard of them, which is the fact that this originated at a time like you think of like 60s counterculture, you think of hippies, you think of people on the university campuses protesting, but at the same time, it was sort of introduced as like a street drug, a party drug, a rave drug. And I think the negativity on this, along with the whole war on drugs and the negative PR and all accumulated to the fact that these universities that were doing research in the 50s and 60s were immediately just shut down. There's been this decades-long ban on funding and research. There's sort of been this weird black sort of like black hole, or essentially just this huge chasm of just like gap of ignorance from when it first started research into psychedelics to now where it's being picked up literally like 30, 40 years later. So we're kind of essentially just far behind. But like I said, this is a new space that's kind of developing. So we're kind of excited about this space. It's just really interesting to just not the whole like spirituality stuff, not just that. That's pretty interesting to see like how people actually go into the whole spiritual stuff, which is a totally different idea. But the fact that these are mind altering and some of the anecdotal evidence that people kind of prescribe to it, like the whole like, I went under some sort of like spiritual journey and how their personalities change. And there's like a huge database of just anecdotal evidence about this stuff. And so, I mean, like it's a whole episode in of itself. So we're hoping to find people, experts, and just more in-depth research for the viewers and listeners to kind of look into this area of psychedelics and probably even an area where some other people who are listening might want to pursue their sort of areas or their sort of area of discipline in for the future. Yeah,
we're really looking forward to recording that episode. As such, as always, if you have any questions or you want us to look into anything specific, let us know, because especially we can ask our guest that comes on, or even if we make an episode with just us two, we can try to answer as many questions as possible.
Yeah. And with that, we'll just move on to our last segment, which is our 3 takeaways.
Yeah. So as you guys know, this is our recurring segment.
I guess we can just do a joint one for the sake of our episode. I would say the first takeaway I have is that mental health, there's sometimes there's like a monster like in the cause we don't want to like tackle, like something like mental health, especially now, like even after the episode, some people might find this a bit morbid. The fact that like now we might have to deal with a bit more bigger monster post COVID or whatever. And I think there's like never any challenge to kind of back down with. It sort of goes to the whole mantra, like never giving up. And I think it's something pure because it's like people's lives at stake. And I think it's just like with regards to something to mental health, I think you can always tackle it. I think there's something about perseverance and persistence and resilience that's just unique to the human spirit. And I think people can just push through regardless. So I think we give people nowadays less credit and less ability for them to solve their own problems than we normally do. And then people always have had it in them to be more resilient. I think we should be propping up more people to be more resilient.
For sure. Yeah, my takeaway would be, raise awareness about this topic and try to reduce that stigma. Of course, if you are going through mental health, there is resiliency involved, but don't feel like you always have to fight it alone. Because if you think it's just you for yourself, it might make things harder. So you can always seek out people, like we said, with BetterHelp. You can seek out your friends, your family, whoever you feel comfortable talking to. And, eventually, if we keep on talking about this, we keep on reducing that stigma. Eventually, this wouldn't have to be that big of a problem because people know about it so much. You can tackle it much more easier and, figure out what to do and figure out the cure much more easier too.
Right. And I think the last one that we can talk about is essentially the fact that there's huge innovation still to be made on a biotechnical scale with regards to mental health. I don't think it's just mental health, but more so the bigger area of psychedelics, which has multiple applications, not just in mental health, but like we said, alcohol addiction and everything else. And it's literally an entire universe in and of itself. And there's like amazing resources on the internet. I'm pretty sure many universities are now offering free courses, and there's institutions online that are offering certified courses for people that are interested. You can actually pay a particular fee to obtain certifications in the psychedelic space to become like a therapeutic or to become like someone specialized in one of these particular substances and drugs, which, like I said, is a universe on its own. And I'm pretty sure there's plenty of other podcasts and plenty of other resources out there that sort of speak more towards the psychedelic space and its applications. And just the fact that some of these things are historically have always been there in some societies, like psilocybin and ayahuasca and all these other things, which have sort of been in societies for the longest time, like hundreds and hundreds of years, Native American and indigenous populations. But like I said, there's like a whole different world out there. And I think like people tend to think like a lot of the things that we like speak about, or a lot of these problems have sort of stagnated, like basically everything's done, like everything's been done. But oftentimes it's just felt like it's been done because we're at a stagnation period. And I think sometimes it just takes, unfortunately, sometimes it just takes like the dire situations for more innovators to step in and say, no, I think there's more to it.
Yeah.
And I think some of these innovators now in the mental health space reside in the area of psychedelics and psychedelic therapeutics that are going to more personalize healthcare and sort of take it to big pharma and just say no more one drug fits all, no more writing prescriptions to people, no more telling veterans that they have to deal with it, no more telling veterans here to take this pill. Like there's people who suffer, there's people who work hard, they're humans too. And I think more and more we're moving towards a more personalized world. And I think that's somewhere the silver lining in this whole discussion.
Yeah. And I think that takes us to the end of our episode. Always remember, guys, be strong, but don't forget you're not alone. And you can always reach out to people for help whenever you need it.
Yep, for sure. And with that, we'd like to bid you adieu, and we'll see you next time.
Take care.
Peace. Thank you for listening to this podcast. Be sure to like, subscribe, comment, and share. Check us out for an audio-only experience on Spotify, Apple Podcasts, and other outlets. Follow us on all of our social media, and please consider supporting us on Patreon. All of these links will be in the description. That's it for us today. Welcome to the new world.